As a patient, you might wonder if there's anything that providers can do to further enhance the likelihood that a fecal microbiota transplant will be more successful. One tool that we have at our disposal is loperamide. Loperamide is a medication, an oral medication, that is given to individuals most commonly with diarrhea. However, what it ultimately does is it slows the motility or the contractions of the colon. Theoretically, by slowing the contractions of the colon in an individual who has recently received a fecal microbiota transplant, it is less likely for that individual to purge that transplant quickly and more likely for the bacteria, viruses, archaea, and other living species that were transplanted through the fecal microbiota transplant to remain and engraft. The usage of loperamide has been mixed. Some providers use it, other providers do not. At a major gastroenterological conference in San Antonio, Texas, in October of 2019, Brandt, Aroniadis, and Nayi looked into their experience with loperamide across the years of 2014 through 2017. They looked overall at 15 individuals who received a fecal microbiota transplant for multiply recurrent C. difficile. Of those 15 patients, 6 received loperamide around the time of their fecal transplant, and the remainder did not. And they compared the efficacy of the fecal transplant between the two groups. As we can see, the group that received loperamide responded 6 out of 6 times. The group that did not receive loperamide responded 8 out of 9 times. Not a statistically significant difference. So it's clear that loperamide certainly does not cause harm as a result of being used at the time of fecal transplant, but due to the size of this study, we weren't able to see a statistically significant difference. Overall, though, it seems as though loperamide is a safe and effective tool to be used around the time of fecal microbiota transplantation. And this is something to perhaps speak to your provider about if you are considering a fecal microbiota transplant, to talk to them and see whether this might be useful for you and help the efficacy of your intervention.